Thank you for joining us for this breakout session. This session is called Implementing Telehealth with Providers and Patients. My two colleagues, Ana Sanchez and Adele White from Community Health, will be exploring how they implemented telehealth in our clinic. So if you're just tuning in, we've had a ton of great conversations the last 2 days, and this one is going to be excellent. I can tell you from experience. So without further ado, I'm going to turn things over to Ana and Adele. Take it away.
Hello, everyone. Good afternoon. So today we're going to be talking about implementing telehealth with patients and providers here at Community Health Clinic. So my name is Ana Sanchez, and I manage the oversight and coordination and scheduling of video appointments, as well as training providers on using video appointments format.
And I'm Adele White. I'm the health education manager here. So I'm managing the patient side and how we communicate about video appointments to our patients.
Okay, so at the start of the pandemic, we, of course, like everyone, we started thinking of how to continue caring for our patients, mainly here at our clinic, keeping social distancing. So what we did is a transition or move to remote appointments to continue caring for our patients. So patients were only allowed on-site for in-person appointment if absolutely necessary. In mid-March, we began transitioning many appointments to phone, as well as we not yet had an idea of how telehealth would look for our clinic.
And kind of to start talking about this, about how we started getting our patients to remote visits, we formed the telemedicine task force. And this is really just a team of people that were all making decisions and asking questions about how we were going to start offering video appointments to our patients. Kind of at the same time as the pandemic started, our EMR, electronic medical record, we use Athena, started offering beta testing of their video appointment platform. So beta testing meaning like guinea pigs. It wasn't officially offered to all Athena clients, but we had a few of our providers who see patients every week starting to use the Athena video telehealth platform. So that's kind of how we started figuring things out.
Okay, on this slide, you're seeing the members that were part of our telemedicine task force. As you can see, these members were making huge decisions in giving structure to the telehealth program here at the clinic. As you can see, we have different members from different departments within our clinic, which that included, of course, our medical director, director of clinical operations, our front desk manager. We needed all these decisions and expertise from different departments, but also we included Mr. John Kinobo, our telemedicine implementation consultant for this.
This is just to show you a little bit about how we started the planning process and how we organized ourselves. So many of you may have seen this before. This is called a Gantt chart. But at the beginning of our telemedicine task force planning work, we had this Gantt chart showing all the different tasks that we needed to do, who they were assigned to, when they were completed, when we wanted them completed by. This just kind of helped us stay on task and organized, because as you'll see as we go along, there's a lot of different steps that we had to go through. We wanted to make sure we're not missing anything as we're starting this whole entire new video appointment project.
Okay, and in here you can see an example of an agenda, which of course our main topic here was technology, what we needed for our clinic in order for us to do video appointments. In here, you can see many discussions that we had. For example, did we wanted to use laptops or CPUs? What type of equipment did we needed to have in the exam rooms for providers, especially for volunteers to use? So this decision, we made the decision with the telehealth task group, where we also engage a telehealth expert matter in technology, which again is John Kinobo. Based on that decision, we went also, we consulted our IT consultant firm, Athena, and Northwestern IT to help us guide us and determine what type of equipment and technology to use for our telehealth appointments.
We really encourage, if your clinic is thinking about starting to do telemedicine, definitely ask people who've done it before. We were completely new to this, and we knew that other hospitals had done this before. So rather than try to figure out what works ourselves, we wanted to get as much information from others as possible. So Anna was super involved with the technology part. I was not, thank goodness, because I feel like that's one of the most difficult pieces. This is a sample agenda of our non-technology topics that we were talking about. We were talking about which video appointment platform we wanted to use. So Athena had one rolling out. Did we want to use that? Did we want to switch to something different? We talked about how to communicate video visit options to our patients. We talked about getting feedback from both providers and patients after their video appointments. So we had these meetings, I believe, was it every other week, Anna?
For now, we're doing it every 2 weeks.
Okay.
At the beginning, it was every week. We needed to chat with everyone and get feedback.
Yeah. So we're meeting pretty often, lots of updates between each meeting. So we really are spending about the entire hour every other week when we meet.
Okay, perfect. In this slide, you will see many question marks around phone, video, telehealth, telemedicine. So the main question is here, how do we refer to a telehealth visit here at CommunityHealth? Some staff are calling them telehealth, telemedicine, to mean phone consult, video appointments. They were listing telehealth. So telehealth in our EMR was listed as telehealth to mean only video appointments. Of course, we needed to come to a decision. For us, telehealth means a bigger umbrella, which we decided to include video and phone consults.
And this really the need came about for us to make sure we're talking about everything the same way, because some students shared some data with us, and I believe the title was Telehealth Data.
Mm-hmm.
And we realized we didn't know whether they were talking about video visits, phone visits, or both. So we decided it was really important for us to nail down exactly what things meant. So now internally, we refer to things as either a telehealth video or a telehealth phone visit. When we're talking to patients, we say just video visit or phone visit, just to, have fewer words. Anna is going to talk about the provider side of all the training and organization and logistics that had to go around getting our providers all set up to do video appointments.
Okay, so in this slide, you will see a picture of our clinic. To be more specific, this is the interpreter sitting area. You can see it is pretty empty. So this is how it is now, and this is how it was at the late March of 2020. So we needed to transition all of the on-site providers to phone appointments. We started doing this in March of 2020, late March of 2020, to be more specific. This included 74 residents from Rush Hospital and St. Joseph Hospital, 23 independent, which there was a balance between primary care and specialty care, to be more specific, GI and cardiology appointments. Medical students, 6 of our 7 student programs transitioned to phone consult by late April and early May of 2020.
So for Anna, this was a lot of people that she, with the help of a few others, thank goodness, had to say like, all right, we're changing the whole way you do things. We're going to have fewer people coming in person and more patients on the phone. Even at the beginning of the pandemic, we switched from having all of our providers coming in-house to some of them seeing patients at home on the phone. So it was not only changes in our patient flow, but changes in our provider flow as well.
And you would think how we would manage all of these providers. So we needed the support of many departments. One of them will be interpreters. How did we do it with many departments? So right now, when we transitioned, we did remote interpreters. It required, of course, more of the staff time. It required more of the clinic support. Will the physicians have a coordinator, a pharmacy team, a nursing team, referral team? All of that was transitioned to be a remote support. They were getting the same support, but just in a different way. We were communicating with providers pretty often. All of the providers received an email with all of the information needed for clinic a day before. This included interpreter assignments, pharmacy formulary, clinic updates such as food pantries and resources, COVID testing. We were doing COVID testing here at the clinic, so they were getting mainly the hours and of course the nursing line if patients had any questions. And who to contact, mainly who to contact during clinic. Again, we have to think that we have 15 rooms, how we needed all the support that we needed for our remote providers here.
Yeah, so normally during a normal clinic, as Anna mentioned, we have 15 exam rooms. Normally a coordinator like Anna will be standing in the middle of those 15 rooms, telling people what she needs them to know, live in person. So this all had to happen over the phone. And so it just took a lot more people power because you do still have 15 appointments going on at once, but Anna or one person is the coordinator helping all these providers at the same time. So it took some getting used to for us. This is a pretty neat slide. This just shows all of our visits broken down starting in March 2020 through March 2021. So you can see that still 67% of our visits happened in person. Many reasons for this, but a lot of our patients needed to be cared for in person, so we did that. You can see that, I can't see the percentages, Anna. Are you able to see them?
Yes, so the phone, we have a 28%.
Okay. And then video appointments, those came on rather new. We were ramping them up slowly. So only 5% of our visits over the last year were video. So you can see, even though, we're talking to you all about telemedicine today, video appointments are still a pretty new thing for us as well.
Okay, and in here, you can see the tracker that we use here at the clinic to see when are the providers actually ready to do the video appointments. So we have listed here the name of the providers, the status. Some of them, as you all know, we have a shortage on and significant delays on hardware. So you can see that we have here pending hardware for some providers. And at the bottom, you can see the providers that are ready. And on the side, you can see the dates that they're coming to clinic or they're doing remote appointments.
And for hardware, that's Anna, that's things like laptops, cameras.
Laptops,
okay.
Cameras. So again, we're waiting and we're pending. It means that the providers are ready, but we're still pending on that technology, on that specific unit in order for us to actually proceed and do the video appointments.
Okay. So they're trained. We're just waiting on them to have the equipment. Got you. Okay. This is just a little smattering of screenshots. So when we started getting ready to train our providers to do video visits, we obviously had to create some sort of organized training to allow them to be good at it, to have the tools to succeed with it. So we did two different things. Our director of clinical services, Emily, she filmed a whole video appointment encounter with me as the fake patient, and we recorded it on Zoom so that any provider who's going to be starting it could see from the provider's perspective what a video visit looks like with the provider charting and doing all of those things. So there is a long video version of that. And then these screenshots are just screenshots from that where we added text instructions if a person doesn't want to watch I think it's about a 12-minute video. This is a shorter version where they can just see snapshots of what they need to know. We don't have, I think, a super lot of time to show this, but I'll just click for like 10 seconds. You can see what the video looks like. It should be embedded here. Yeah, I'll just go to like the middle. Oh, you know what? We're not, yeah, it's being a little slow. We're not going to worry about it. Basically, you can see from what it looks like here, it's walking through the visit exactly what the provider's computer screen looks like. They have the little patient in the corner, they have themselves even tinier. So, and then Emily's clicking through and doing her charting in the visit during this video, and also showing people where to look for things. Luckily, the Athena video platform is pretty user-friendly if a person already knows how to use the chart.
So all of this lead to choosing a telehealth platform. So we needed to do some evaluation among providers and patients.
So yeah, as Anna mentioned, we needed to see from provider standpoint and from patient standpoint, how were people doing using the Athena video platform? We kind of decided to evaluate it because what we found was that some providers were having a lot more success using Doximity and some people were using Athena. So we ended up, we'll show you the list. We ended up finding some pros and cons of each of them. But how we started evaluating is after each video visit, pardon me, we had the provider fill out a little survey kind of asking them how things went. So this first part is pretty important. Out of 56 responses that were collected between August and March of 2021, pardon me, you can see that 30 were completed as video visits. That means they started as a video visit, they successfully went all the way through as a video. 26 of them had to be changed to phone. We're going to talk about some reasons why that is, but a significant number of visits that start as video do end up having to be transitioning to phone because things don't work. The completed video visit satisfaction. Now, this rate of satisfaction is from the provider's point of view. So 92% of the visits, providers said they were satisfied with the video visit, and they perceived the patient to be satisfied 89% of the time as well. There's some of the reasons that we have to change video appointments to phone are technical issues, like if someone doesn't have good enough internet connection, for example, or sometimes just the video link did not work. How it works in Athena is, and actually the same thing for Doximity, the patient receives a text with a link to join a video appointment. If the patient doesn't have strong enough internet connection or doesn't have enough data, this link will not work. So that's just one reason that sometimes video appointments don't stay video the entire time. This is just a really small amount of data, but since some providers were using Athena and some were using Doximity, we tried to look a little bit closer. Obviously, we have more Athena data than Doximity. So nearly 70% of Athena video visits were rated good or excellent in video and voice quality, but 50% of the Doximity video visits were rated excellent or good in voice quality. And as you can see, we have much fewer Doximity reviews. Some providers were, really judiciously filling out their post-visit surveys and others weren't. So we realized this data is not excellent to compare because the numbers are not similar.
Okay, and in here, as Adele mentioned, we actually put a list together of pros and cons. So here we're looking at the Athena list. Of course, our mainly pro was free. The service is free for us, for our clinic. Another huge pro was integration to an EMR. What that means is the providers didn't have to use another platform. It was there, they were on Athena, they were able to connect to the patient. They were not putting another system to connect with their patient. Another great resource was we already had created education material, both for physicians and for patients. So they already knew how to use Athena on both sides. And of course, easy to train providers. Many providers have worked with Athena before. And of course, it's pretty user-friendly. Some of the cons that we have here, Athena is not able to transition from video to phone and to phone back to video. Like Doximity only has one button where if you're not able to connect with the video, you just do one click and they will send you back to the phone consult. Another con for Athena, lots of steps for end user to connect. So we wanted to make it easier for the patients to connect, but then there's some things that we couldn't change.
Yeah, kind of a theme in general that our providers told us, and I've got to talk luckily to some providers and patients. It seems for providers, Athena is pretty easy, but for patients, it is not. Doximity seems to be easier for patients, and there is the big pro with Doximity, with very easily being able to switch between phone and video if one is not working. Again, the cons, as Anna mentioned, our current EMR, Athena, is free to us. That's a huge pro. We're all free clinics. We understand that. If we were to pay Doximity prices, the last I heard, it was $89 a month per provider. And you saw the number of providers that Anna shared in the very beginning of our presentation. That's just not feasible for us. So I'll let Anna talk about what we've decided to do for now.
Okay, so for now, of course, we're using Athena as our main platform in hopes that they would add more feature besides the one that we put in our list here. Most of our experience using Athena was its beta testing format, which had limited features, in hopes, again, in the future, they will add more of the features that will be more user-friendly for providers and, of course, patients.
Mm-hmm. And we are in touch with them. We've told them what features we'd like to see and feedback from our patients and providers. So we're hoping we can push them in the right direction a little bit with that. So I'm going to talk a little bit about what we've done to try to integrate our patients a little bit more into video visits. As you can imagine, there's some hesitancy around this. Let me just check, we have a question. Oh, yes, we do use the free version of Athena. I think it's probably the same as yours.
Yeah, so they also mentioned that their office has the free version and they were told they didn't include the telehealth platform. We were included on the beta testing. So they did offer as part of the beta testing, we were part of that. I'm not sure exactly.
Yeah, we can try, if you drop your email in the chat, I will try to get an answer from you from one of our Athena super users, Ruth and Emily, because I'm not quite sure. I feel like we probably have the same free version as you. Thank you, Mark. We'll get back to you on that. Okay. So hold on, it's just being a little slow when I click. Well, I'll see if I can get, there we go.
Okay.
So this graph just shows the total number of scheduled video visits, completed video visits, and completion rate. So what we'd like in an ideal world is for every video visit that's scheduled, we'd love for all of those to work as video visits all the way through. But as you can see, it doesn't always happen like that. So this is, I'll just put an example of October 2020. There were 66 visits scheduled as video, but only 30 of them were able to be completed all the way through as video. That means the rest of them, those other 36, were transitioned to phone, likely due to technology issues or connectivity, or possibly the patient was mistakenly scheduled as telehealth. We're going to talk a little bit about why some of those reasons are that make our completion rate not 100%. This is kind of neat though. Our completion rate did go up, more recently. So we are, hopefully that means we're learning and helping our patients and providers more to have success in their video visits. This is a lot of data on one slide. I'm just going to go over a couple of things. So right over here on the side, you see that over the last, 6 months from October to March, we had 536 appointments available that could have been done as video. Now, only 288 of those were scheduled as video. There's many reasons, we'll go over a few about why a patient might decline to have a video visit. 223 were completed, and the no-show rate is 6%. Now, this is something that we really like about remote appointments, is that our no-show rates have gone way down when people have the option to do phone or video. This little pie chart here shows completed telehealth appointments. Now, this was written before we had our little discussion about what to call it. They mean video appointments here. So these are completed video appointments. And then these are the number that were changed to phone. So you can see it's a little less than half. Generally, that's what we've been seeing until we started to improve a little bit. About half the appointments had to be changed to phone. Yeah, we're going to go over on the next slide some of the reasons that patients may choose not to have a video visit. Not comfortable is the biggest answer given, and that could be for a lot of reasons. People sometimes don't say the reason. Being not tech savvy is a big one. We think that also is included in not comfortable. Some people prefer phone. This could be because they are out on the go or something, that they don't have to be somewhere with internet. Some people, they can't accept video calls. This could be they don't have a smartphone, for example. Some of these, is when you can't reach a patient to ask if they want to switch their phone appointment to video appointment. Because how we've been doing this is when a patient has a phone appointment scheduled, someone's calling them a few days or a few weeks ahead of time to see if they would like to switch to video visits. A lot of them aren't scheduled right away in person because we were pretty new at this and didn't know how many video appointments we could offer. As you all can imagine from your experience with your patients, there can be a lot of really, big technology barriers when it comes to asking a patient to do a video visit. So it's, of course, lack of familiarity and experience. It's intimidating to try something new, especially if you feel like you're not a tech person. Many of the patients have had success with doing video visits if they have a super tech savvy family member to assist them. Our average patient age is skews towards middle age, 40s, 50s. And those people who maybe have an adult child or a teenager even living in their home, it's really nice if they have someone to help them. We know a lot of our successful video appointment patients have had that family member to help them. Really, really big one is lack of access to internet or low strength of internet at home. Kind of what we figured out now when I talk to patients and ask if they want a video appointment is I say, can you stream Netflix or Prime or any sort of video in your home? If your internet does not do that, it likely does not have the strength for this. It's not the same thing as watching a YouTube video, right? Because that's not live streaming. So a lot of people's internet maybe just isn't strong enough to do this live stream sort of experience. A lot of our patients too choose not to have internet in their house. They only use internet on their phone. So it's just a data plan. If I only have a data plan on my phone, doing a video appointment for 15 to 45 minutes is going to use a ton of my data. So that's a big thing for people too. And then of course, some people just don't have a smartphone, a tablet, or a computer. And even though some people did have them, we did hear patients say like, all my, kids are doing at home school. I just can't be on a tablet. My kiddos are using it. So that's certainly something that happened too. Just besides the tech part, there's other things that we need to consider that patients have shared with us. So sometimes there's just not noise, there's not privacy at home, there's too much noise, and people can take a phone call anywhere. They can't really take a video call if they need internet outside of their house. Of course, there's hesitancy around letting a provider see into their home. That's a very personal space for some people. And then a lot of people have said the reason they want us to be seen in person and not over phone or video is that their provider may not be able to assist them as well. And of course, this makes sense. The provider can't touch them or measure things in person. It makes sense why there's that hesitancy. This language barrier things is a huge one. Right now, Athena, so our current EMR that we're using for video appointments, does not have the ability to add an interpreter directly to the video appointment. The provider still has to have them on a separate phone. Not ideal. Another way that language is a barrier is that when a patient gets the link, if all the texts and screens are not in their preferred language, that can be a barrier. Currently for Athena, some of their screens are in Spanish, but the text they get with the link is not in Spanish. So there's some growth that we can all do as far as this. So the language barriers and using interpreters certainly makes things more complicated. We don't have time to show this, I don't think, maybe just like a couple of seconds, but we did create for our patients a couple of different things. We have video instructions and written out instructions to help a patient understand what their video appointment is going to be like and how to log into it, get it started, things like that. We have the same thing for our providers. That's what we saw earlier. We have sort of slides that show visually what a provider is going to get during their video appointment, and then a video that shows exactly how that looks on screen. And our future project is we are going to get patient opinions and testimonials about their video appointments. So now that we have a few more patients getting it done, we want to ask them how it went for them. And we hope this will encourage some people who might be on the fence about doing a video appointment that it might be worth a try if they see that other patients have had success with it. So let me just show you like a couple seconds of this. I'll just go to the middle. Okay, so we filmed this using Adobe Spark. It's free for anyone that wants to use it. I did a Zoom screen share on my phone and recorded it. And then in between those literal phone video parts that you can see, you put instructions. It's pretty cool. So we created this in 3 different languages for all of our patients. And again, the main part that's helpful is it shows exactly what your phone looks like during a video appointment, because we know that's how many patients are going to be doing their video appointment. Anyway, we made it slow just for, varying levels of literacy, but this is what it looks like. Yeah, they can see the text. So we don't have time to go over all of this, but I'll just pause it for now. Here we go. It's a little slow once I show a video. Sorry about that, one moment. Here we go. And this is the much more quick to look at, easy version to look at. So this was created in Canva. If you guys have ever used Canva, it's a really great way to create nice designed things. So this is a one-sheet page. Again, we have it in our 3 main languages that shows a patient how to do their video visit. So it shows what the text look like. This is literally a phone screenshot. What the welcome screen looks like. We have a QR code up here in which a person can take their phone and scan that QR code, and it opens up the video that I just showed you. So we know that it's important in order to get our patients on board. We need to give them the tools for success, and we hope these are going to work. It's possible that we might have to change things if we get feedback, but for now, these are the instructions that we have, and we feel like they've been working pretty well. Let's see, so similar to what Anna was sharing about our provider surveys that we ask our providers to evaluate how the video appointment was after their appointment, we did the same thing for a number of patients. So first question, super straightforward, were they satisfied with the appointment? We did ask straight out, which type of appointment is most convenient for you? If they would like to have more video appointments in the future. And then we also asked if they would be willing to be contacted about their experience in a video appointment. I did this to gather data about what specific things made a video appointment good or not good. That was pretty helpful. So I'm just going to very quickly go over the results. These are in Spanish because most of our patients are Spanish speaking, so that's the most survey responses that I got, but I have English on the side so you can see it. So this is a really encouraging slide. 95% of the people who did this video appointments said they were satisfied with it. Now, the caveat to this, the only people that were surveyed are those that it stayed a video appointment all the way through. So basically anyone who was scheduled for a video visit, but because of tech issues had to be transitioned over to phone, those are not in here. These are people whose video appointment worked from start to finish. So as you can see, most people were satisfied, which is great. This is when we asked what type of appointment is most convenient for the patient. So you can see, 37% prefer a video appointment. Some people prefer phone, most people prefer in person. The reasons I heard for this when calling people really vary. If a person lives far away, they're going to be much more inclined to say they prefer video visit. People who said they prefer phone, every person I talked to who fell into this category said it's because the sound or video was not good quality. So of course, once they have that experience, it might take a little bit of a nudge to get them to try video appointment again. This was interesting. I would expect that this would be the same as the 95% and 5% on the first slide, but it wasn't. So about 75%, so 74% of people said they would like to have another video visit with their provider, but about 1/4 of the people said they wouldn't. So, I mean, that just kind of tells us that some people thought it was okay once, but they wouldn't want to do it again. We also heard, though, from patients directly that it depends on the type of appointment, whether they want it to be video or phone. So Anna and I have both heard this from patients that things like a med refill appointment or things where they don't feel like they need to be physically assessed, they feel more comfortable doing by video. And things where they're presenting a new problem, they have a new complaint, they don't want to do it by video. They want to come in person so they can be assessed. And one reason I've heard for this is because they're afraid that if they do it by video, the provider might say, oh, I need to see you in person to really assess this. Now go ahead and make another appointment. We'll see you in X amount of weeks, which I can certainly understand.
Though you have a question there in the chat.
Sure.
How did you conduct the survey? Text, phone?
Good question. So for this particular survey, because people had to do video appointments to do it, I knew that their texting worked. So I did this by text. I used SurveyMonkey. And then I did offer a raffle incentive to get people to fill it out. That always helps. But then to get specific feedback, if they marked yes to the question that they would be willing to provide more information about their visit, that's when I called people and found out specific information. Good question.
Thank you for asking that question.
Mm-hmm. Oh yeah, so now we have, let me just check our time.
10 minutes.
We have 10 minutes. So yeah, if you all have any questions, I know we sped through that. please ask us. Otherwise, we can show a little bit more of the video. Yeah. Did I miss anything, Anna?
No, I think you hit all the points. Once again, many of our patients would never be ready for a video appointment, and many of them, they just need to get that experience in order for them to say, well, this doesn't work for me. I don't like it. I don't want to do it again. So I feel like all the material that Adele has created, we have placed all the material in the exam rooms, especially the QR code. They don't want to read, or they don't want to take that sheet with them, which is the provider will be, let me just scan your QR code, watch this video, let me go ahead and talk to my attending and come back. And they will actually say, you know what, yes, next time I don't really have to come all the way down here. We can just do a video appointment. I feel like all of this, if they hear the provider telling them that they qualify for a video appointment, that makes a huge difference.
That's a really good point, Anna. This actually came up in our last meeting as far as who's really selling the video appointment the best to patients. So we've talked about, like, how are we going to get our numbers up for these video appointments? We know they're really helpful when patient and provider can do them. And we've found that when I offer them, or when our front desk staff offer them, or coordinators like Anna, it doesn't mean as much as when the provider says, hey, I would like to see you by video. They know, like, okay, my doctor's recommending this, maybe I'll give it a try. So if you all decide to start implementing video appointments, definitely have your providers be the selling person on it, because that's, you know, who a lot of patients are going to trust the most.
Yes.
Let me go back. Yeah, if you all don't have any questions right now, feel free to drop them in the chat, if you will. I will show a little bit more of, which do you think, Anna, the video for patients or the video for providers?
See, I feel if we have time, we can share both. I feel like we have some time.
Yeah, so the one for patients is shorter. It's about 5 minutes, and it's 5 minutes because it's pretty slow paced to account for varying reading levels. Provider
Very detailed.
Yeah. Let me see if I can. I hope you all can see this on the big screen. Laura, feel free to text me if you can't see this.
It's not playing.
Oh, it's not playing?
Mm-mm.
Okay. All right, we will go back.
Well, we can still, we're gonna share this presentation so you can just watch it later.
I wonder if it plays if I leave it in here. Can you all see it now?
No.
Okay. Yeah.
We have no sound, but we can see it now.
Oh,
it's
okay.
Working, yeah.
If you can see it, we'll just play it while it keeps talking. So yeah, this was just filmed like a Zoom screen share on my phone. We used Adobe Spark to edit it. Really, I want to go through with as many patients I can in person, whether or not this has enough information for them to be able to feel more confident doing a video appointment. I think any internet connectivity is really a big thing, because a person knows pretty close to the time they start the appointment whether it's going to work or not.
Adele, you have another question here. What were some techniques used to recruit responses to the survey?
Oh, raffle. It's so funny. Any survey that we do, we will also, we always get better results if we offer a raffle. I think we did a $100 Amazon gift card, but you know, even I would fill out any survey if I could get a $100 Amazon gift card, even a chance of one. Okay, and Laura says 3-minute warning.
3 minutes.
Yeah. Any other questions we can answer for you all in our last couple minutes? I'm trying to think other important things I've heard from
our patients
as well. Another thing that's kind of interesting is that, you know, since many of our patients live in basements, those tend to be the cheaper apartments in many buildings. That is affecting their internet connectivity a lot. And I speak from experience living in a basement too. I had the best internet plan at that time, and my internet still didn't
more
work
questions
well.
there.
How often do you find that appointments require an in-person follow-up to handle? That was a question we asked our providers, and I didn't put the info in here, but it was only about 20. It was like really not very many. I want to say like 20% said I need to see this person in person. As we open up video appointments to more people, that number might go up. I feel like one thing that we want to change is we want to change our screening process. We don't want to be offering video appointments to someone who is presenting with a bunch of new issues. So we might internally decide to only offer video appointments for certain appointment types and not others. Yeah, we're learning.
And also front desk is very good at screening this. When they call them to schedule an appointment, they will tell them, hey, I'm presenting with these symptoms. And we know that this is not going to be a video appointment. This will be an in-person appointment. So front desk is very helpful at doing this too.
Yeah, they have probably more experience than any of us asking. And we also need patients to tell us, like, when they're offered a video appointment, do you have a smartphone or somewhere to take it? There's been a few that were scheduled, I think, on accident, maybe by someone where the provider didn't realize the patient doesn't have a smart device. So of course they're not going to be able to do a video appointment. Yeah, good question. Let's see. Yeah, we can go ahead and wrap up for you all. Thank you so much.
Thank you.
Yeah, you're free to email Anna or myself if you want us to share anything specific. And I know the IAFCC team will be sharing a lot with you guys after.
Yes.
Awesome. All right, I have our emails down below. Thank you all so much for your time. See you soon, maybe in person.
Thank you so much. One day. Thank you.
Thank you, Anna and Adele. Thank you for the great presentation. And as they said, feel free to follow up with questions.